The pandemic highlighted existing gaps in the healthcare system, and the premiers are demanding more money to address the issues. Dr. David Naylor is the co-chair of Canada's COVID-19 Immunity Task Force. He's also a professor of medicine and president emeritus at the University of Toronto. Dr. Naylor, thank you for speaking with us today. I want to get your take. What do you make of the split of this portfolio in health?
Thank you, Katie. It's an interesting return to something that happened after SARS. You may recall that in 2003-04, we had a Minister of State for Public Health, none other than Carolyn Bennett, who filled that role, trying to stand up the Public Health Agency of Canada, and Ujjal Dosanjh was the Minister of Health. So we've seen this configuration before when there was a desire to get something going. In this case, we have a focus on mental health, good focus. Big job for Carolyn Bennett. She's been here and done it in the past, but this is a big one.
I'm going to talk about Minister Duclos and his new role in a moment, but you mentioned Minister Bennett and the creation of this new mental health and addiction portfolio. If you were her, what would you want to make your main priority in trying to create something to deal with this crisis?
I think it's absolutely essential that she get clarity about the two parts of this portfolio. They intersect. But on the mental health side, of course, we have obviously all the pandemic effects. We have a big challenge with meeting demand for mental health services. So we need real creativity there, partnerships with stakeholders, some coalition with the provinces if we can get there. Not easy right now because of the financial issues. So that's part of it. But the addiction piece and the opiate crisis, a massive challenge that has to be tackled through a variety of other strategies. And there's a social imperative in the middle of the two that has to be dealt with directly. I mean, if you look at mental health and housing and being underhoused or homeless, these are huge issues. They spill over into addiction. So she's got a big area to cover, and she's going to have to pick her spots and find her allies to get anything done.
The pandemic has exposed a wide range of weaknesses within healthcare systems across this country. With that in mind, what do you think the most pressing issue is for Minister Duclos?
I think the minister has a whole lot on his plate. And one of the challenges, obviously, is that we've seen multiple closures. We have a huge backlog. And so there's an urgent need for Ottawa and the provinces to collaborate on getting our healthcare capacity up, running better than ever, probably running overtime to provide the services that have been backlogged over the last 18 months with intermittent interruptions of the hospital system. So there's the sort of patchwork elements. But then riding in the background is this ask by the premiers for $28 billion of base funding. You think about it, Katie, the transfer is around $40 billion a year in cash currently. $28 billion is a big chunk of that, a big raise. And that's money that I'm not sure the federal government is going to be able to put on the table very quickly. So they're going after issues that require close collaboration with provinces and territories at a time when there's a cloud in the background, and that is this enormous request for a boost in federal funding. It's not going to be easy to get things done. And the last thing I'd say here is we have a lot of gaps in our Medicare system. We need Medicare 2.0. We need a big reboot. We need to address health human resource issues. All I can say is Minister Duclos has a full plate. He's going to have to figure out how to get some things moving quickly. And he's going to have to pick his spots for a while to get anything done.
You mentioned one of the things I wanted to ask you about next. The premiers are united in calling for that huge increase in health transfers. What are you expecting from the federal government? Are the premiers' demands, which they are united in their demand, are you expecting the federal government to sort of meet their demand?
No. I think the healthcare systems across the country do need more funding. I think there's a case to be made in terms of what the federal funding levels might rise to meet. We've examined that work I did with Dr. Bazari and Dr. Adams, published last year. You can benchmark quite a large shortfall depending upon how you do the math. So we need a rational and fair way to figure out what the share is that the federal government should cover. But a boost of that magnitude, very hard for them to do after major pandemic outlays. And very hard for them to do without knowing exactly how the funds will be used, because Simply passing over that amount of money without some sense of a strategy or coherence, tough to do. Last thing I'd say is the whole game of conditional federal transfers, which has been integral to building out our healthcare system, is tougher to sell. Asymmetric federalism has been baked in, and now other provinces also want relatively unconditional money. So I don't see this money materializing quickly in the hands of the provinces and territories, Katie.
One other issue that you did mention is the crisis in the healthcare worker sector. The Canadian Medical Association wants the federal government to sort of lead the way here and invest in sort of a strategy to help, grow the workforce and really give the workforce the support it needs. Do you see that as something that could be a realistic ask that comes to fruition?
Yes, I do. I think that's one where the provinces will be supportive, where we all need to work together. It's been a tremendous stress on all Canadians. So hard, of course, on people who have seniors who have been in long-term care, particularly those who've lost loved ones. So it's been a tough time for all Canadians. But those on the front lines of healthcare have faced a special burden. And we've got a lot of burnout, a lot of PTSD. We did not have a very good health human resource plan to begin with going into the pandemic. So I think this is a smart ask by the CMA. I think it's one where the Minister of Focus on Mental Health Services and Addictions will have obvious sympathy as a family physician herself, and Carolyn Bennett can help out along with Minister Duclos. And it would be nice to see some real progress made on a coherent strategy for not only health human resources, but better quality of working life for all of those who work in the healthcare sector, professionals and all frontline workers. They need it, they deserve it. I'd like to see something happen there, and I think it will.
Dr. Naylor, thank you very much for your time today.
A pleasure. Thank you, Katie.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.